Alrighty, I think we're going to get started. So good afternoon, everybody. My name is Alex Stark, and I'm the wellness specialist for Sun Health. Thank you all for joining me, whether that be through the Zoom invite from our website, or if you're joining me live from YouTube, live on youtube.com. Thank you so much for joining me today. We're going to be talking about getting the facts about high blood pressure. A couple housekeeping things is I do have microphones turned off for the presentation, as I will be recording it. In addition, if you do have any questions throughout the presentation, you're welcome to ask them in either chat box, whether that be through Zoom or on youtube.com, and I'll be monitoring them both. But I will be recording the presentation, so I'm going to keep microphones turned off. If you do have any issues during the presentation, please make sure to let me know in that chat box. No one else can see your comments. They'll all go directly to me, and I will correct those as we go. But without further ado, thank you all so much for joining me today so that we could talk more about the facts about high blood pressure. So with the facts about high blood pressure and everything going on, different things can affect your high blood pressure, including stress and changes in physical activity. So I thought this would be a good topic to add as we add these online classes, as we're unable to meet currently in person. But so let's get started. So a quick overview of what we'll be talking about today is we're going to go over the general guidelines for blood pressure and what it is. Then we're going to look at the updated guidelines from a few years ago and what changes have occurred recently. And then we'll move into the risk factors that can increase your chances of developing a more permanent case of high blood pressure and not just temporary high blood pressure from a certain activity or a certain influencer on your life, but just regular higher blood pressure. And then we'll go on to what the risks are of having that higher blood pressure consistently, what options we have available to us to prevent this from occurring, and also what we can do to help reverse it once you have a diagnosis of hypertension, which would be the medical term for high blood pressure. And then we'll go into what measures can be used to measure your blood pressure to know what it is accurately, so you're not getting a false high or a false low that might negatively impact your ability to change your behaviors to improve your blood pressure. And then we'll kind of go over a couple true or false. If you do have any questions, you're welcome to ask them at any time. I will be reviewing the chat as we go along, but I most likely will be answering most of them at the end. So just keep that in mind if I don't answer your question immediately. Well, let's get started. So let's talk about high blood pressure. So blood pressure is measured of the force of the blood against the blood vessel walls. So when you imagine a hose tube and the blood rushing through the hose, we're actually measuring the force hitting the edges, the interior edge of that hose. And that's the measure of the pressure, since it's the amount of force being exerted there. We usually measure it with millimeters of mercury, even though mercury isn't being used in any of the devices anymore for the measurement. That is the standard being used by the cuff. So the top number is the systolic measurement. So it'd be your systolic over your diastolic, which is that below number. So the top number being when the heart beats. So it's the highest pressure when the heart is actively pumping the blood into your arteries and veins. And then the diastolic is going to be that relaxation in between the beats when the flow is kind of relaxing, getting prepared for the next. So looking at this diagram is you're seeing where the pressure is being pushed on those walls, and the blood pressure is measuring how much force is needed against those walls. With it being when we're actually measuring the blood pressure is the cuff is pushing against those walls, and we're able to hear a sound that lets us tell when the pressure within the artery walls is stronger than the cuff pressure. And these are called Korsakoff sounds. So what exactly is high blood pressure? So high blood pressure, it can rise and fall throughout the day. So it's based on many factors, but when it stays high over time, then it's called high blood pressure or hypertension. So if you go for a run or you are scared by someone surprising you at a surprise party, any of these kind of shocking behaviors might slightly elevate your heart rate or even dramatically raise your heart rate for the moment. And that's not necessarily a bad thing since it's your body responding to an external stimuli. It's when it stays high over an extended period of time, since that's where damage can occur from the constant high pressure against those artery walls. So usually there's no warning signs of high blood pressure. That's why it's commonly referred to as the silent killer. Is you don't usually feel symptoms directly from high blood pressure in most cases. So because of that, it's usually we don't know there's high blood pressure without regular checkups, or it's developed to affect another part of our body, such as our kidneys or our heart in a different way, that now we're checking it more regularly. So because of this, it's always important that you check your blood pressure regularly, especially under different scenarios. There are many people who suffer from white coat syndrome where their blood pressure is elevated when they go to the hospital. And so because of that, it can be beneficial to check your blood pressure at home as well, since this allows us to see what maybe a more regular behavior and lifestyle choices is what our blood pressure is like then. So it is important to check it regularly. If you do have a history of high blood pressure within yourself or in your family, it is important to check it more regularly. There's no issue with checking it daily. You don't want to check it back to back. So if you check it once, you do want to let it recover for a second before trying again. So don't repeatedly check it over and over, but you can check it regularly throughout the day or once every single day without any negative signs. So it is a common condition, and it does affect 1/3 of the adult population, which comes out to about 75 million people have high blood pressure. That doesn't necessarily mean they all know it, but is many people have it without even being aware that their blood pressure might be higher than what would be considered normal or healthy. So it's only about half of these people have their high blood pressure under control. So whether that be medication, changes to your diet, or some of the other things I will go over later in this presentation, is only about half of those individuals have taken some action to help control their blood pressure. So many individuals are not taking any action, which is when we can see some of the downsides to constant high blood pressure on our bodies. So more than 360,000 American deaths occurred in 2013, including high blood pressure as a primary contributing cause. So what this means is even though we might not notice it, high blood pressure may cause a ruptured blood vessel, or it may have led to damage to our kidneys, or maybe it's caused extra stress on our liver or another part of our body. And because we're not able to recover as quickly, or maybe it's hardening of the arteries and the veins or a buildup of plaque. Because of this, is there are many deaths associated with high blood pressure, even though it may not say that the cause of death was directly the high blood pressure. It is a contributing cause that probably resulted in whatever was the leading cause of death for the individual. So there are new guidelines that came out in 2018 for high blood pressure, and it did add an additional category, and it did adjust the number slightly. So you probably have heard before that a regular blood pressure is 120 over 80, with the 120 for the systolic and 80 for the diastolic. Well, in 2018, they changed it to be less than 120 and less than 80. So a normal blood pressure would actually be slightly less than that. Now, when we are looking at blood pressure, we do usually do it in even numbers when you're taking the measurements, not as mandatory as it is with heart rate, but is if you have 120 over 79 per se, is technically you would start falling into an elevated category. So with your blood pressure, you want to see it less than 120 and less than 80 overall. So with this, the new elevated category is when you have a systolic of 120 over 129, but you still have a diastolic that is less than 80. So what this tells us is that we're more concerned about changes in that systolic number since that's the highest pressure. So that's why we look at the elevated, since usually we will see a raise in the systolic blood pressure before we see a raise in the diastolic pressure, since we'll see the force increase during the actual beating of the heart versus the relaxation phase. So your heart still has, or your arteries have time to recover and drop that pressure back down. So that is why we call it the elevated heart rate. And it would fall into a category very similar to pre-diabetes. It doesn't mean that action is immediately going to be taken, but it is a sign that you want to more closely monitor your blood pressure and make sure we don't see any additional changes. Or in addition to that, is this would be an excellent time to help lower your blood pressure and take action now before we move into that high blood pressure diagnosis, which starts with stage 1. So that's when we go into this orange field. And so high blood pressure, hypertension, is broken into 2 stages plus an immediate crisis situation. So the stage 1 would be when you have a systolic of 130 to 139 or a diastolic of 80 to 89. And so the important thing to think about here is you may have a systolic that was 118, which would put you in the normal range for systolic, but you have an 82 for your diastolic, and this does automatically categorize you as having hypertension. And because of that, something to keep in mind, you don't necessarily always have that recognition of elevated before you move into stage 1, since we're more closely concerned with changes in the diastolic blood pressure. And that's because, one, it's a lower number. So raising by 1 is a bigger impact than a raise of 1 in your systolic. Is also, this is the relaxation phase. So it's not like our heart is beating too hard. And because of that, we need the heart to not beat as strongly. Is because of that, we want to keep in mind that changes in the diastolic we need to approach more closely, especially because we want to make sure there is a difference between systolic and diastolic. So we want to see a gap in between these two numbers. And as the numbers actually get closer together, that's the biggest area of concern, because we need to see an actual contraction stage and a relaxation stage. And if both of these are high, then your body isn't able to adapt and recover, and it's constantly high, which does much more damage than a high phase and a low phase, if that makes sense. So when you're doing the measurements for yourself, if you do have a measurement that is slightly high, don't immediately concern yourself. If you do immediately freak out, that might raise your blood pressure more, which makes that second measurement a little more difficult. I usually say the best way to measurement is to relax, take a deep breath, and sit perfectly still for 5 minutes before you try again. So you do want to wait 5 minutes. You want to keep your arm supported. So if you do have an armchair or a table you can put your arm on, do rest your arm on that surface when you measure your blood pressure. Even if you're using an automated cuff, the machine works very similar to how a human measures it, where it's listening for those sounds, and any external noise makes it more difficult to get an accurate reading. So it's important to sit perfectly still, because you actually, especially when using a machine to listen to your blood pressure, is talking can actually throw it off, since your voice can vibrate and it can misread that as one of the sounds, especially on the lower end of the blood pressure. So don't talk to anyone, sit calmly still for the most accurate reading. And if you do want to check it again, wait at least 5 minutes of sitting perfectly still. Don't get up, move around, and come back again. Try and just sit and relax and let it return to that resting blood pressure, which is mostly what we're looking for, is that resting stage. Is we're not when you're working with athletes, you may look at what their heart responds to, or if you're doing a stress test, we may look what it is under stress. But when we're looking at it from when we ask what your blood pressure is, we're looking for your resting blood pressure. So then we move into the high blood pressure stage 2. So this is a more serious concern, and where medication is almost always required in the initial stages, is where you have a systolic of over 140 or higher, or you have a diastolic of 90 or higher. So either of these numbers, again, can throw you over. One might be perfectly fine, but if the other is high, this does move you into the next stage. So it is important to keep track of both numbers, your systolic and your diastolic, and see which one is changing. When you do exercise, we will see a change in your systolic where it does rise. We really do not see a huge change in our diastolic while we're exercising, though. So it's important to keep in mind, even if you did exercise and move around, there shouldn't really be a large change in the diastolic pressure, since that should be when the arteries are opening up and relaxing to let the flow through, and there's no active contraction. So even when you're exercising, your blood pressure might get up to 140, 150, even maybe 170 for some younger individuals under high pressure, but their diastolic is not going to change a whole lot. And so that's important to keep in mind, that even if something might be influencing your blood pressure, if it isn't an ingestive, an external factor like exercise, shouldn't really be affecting your diastolic blood pressure. Now, if you ever do have your blood pressure taken, keep in mind that if you do get a reading of 180 at rest and or a reading of 120 for your diastolic, this is time to consult a doctor immediately. It doesn't mean you necessarily need to panic and run as you can. Relax and take another measurement just to make sure that it wasn't a misreading, or maybe you had the wrong cuff size, and we'll get to that shortly. But it is a sign that you may want to mention it when you go in, or you may want to plan a doctor's visit and see if your doctor recommends coming in immediately. If you are in a less controlled environment, I do recommend calling 911. So when we're going back through these again, is the normal blood pressure would be less than 120 and less than 80 for your systolic and your diastolic. And if you are in this stage, there's no reason to take any actions. Keep staying active, keep eating healthy, and you shouldn't see any changes here of any immediate concern. So just keep up the good work and stick to your healthy heart habits. So the next stage being the elevated blood pressure, and this is with 120 over 129, and you still have a diastolic less than 80. And this is when you have an elevated blood pressure, and it could likely develop into that stage 1 hypertension. So it's important to keep that in mind, that this is when you can take action and make sure there isn't any immediate changes being necessary. Now, as we move into the first diagnosis of hypertension, and in being stage 1, this is where you have a 130 over 139, or that diastolic of 80 over 89, so either or. And at this stage, high blood pressure, doctors are likely to prescribe a lifestyle change and may even consider adding a blood pressure medication to help you keep your blood pressure down, since that high rate of pressure over an extended period of time is what will lead to some of the other conditions that we might see later. So there are heart risk calculators. So when we're looking at our heart health, there are factors that can influence our blood pressure and can also influence its effect on our heart. So the number one influencer on our heart will actually be our age. So we will see changes in our heart rate as we age, where it will get slightly higher. And that has to partially do because our brain is built to have a connection to the heart that tells it to slightly slow down, but there is a nerve built into the heart that will automatically beat the heart at roughly 100 beats per minute. So if that connection was ever affected anyway, maybe from an impact or something else to occur in your life, the heart knows to continue to beat, even if it's not communicating with your brain, but it does beat at a slightly higher rate. And as we age, we try to depend more on the built-in pacemaker in the heart and less on our subconscious trying to slow down the heart rate. So we do see slight elevations because of that. Gender does have an influence on this as well. And so we do see changes in the heart rate between males and females. So males do tend to have a higher risk of its influence on the heart. So it is something to keep in mind. as we age and looking at other impact styles is men are more likely to develop heart risks, especially when associated with high blood pressure. And there are differences in high blood pressure between different races and cultures. So African American, some Asian cultures, and some Filipino cultures, and some other Hispanic style Southern cultures all have variations in high blood pressure. And also Native Americans are also at an increased risk of the heart being affected by some of these behaviors. So just keep in mind there are genetic components. So if you do know your family history and there is a family history, or there's just a genetic likelihood, your physician might pay closer attention since there might be a higher risk than some other populations. Your total cholesterol does affect your overall blood pressure, as does your HDL, which would be more known as our good cholesterol. So high numbers here does have an impact on our health. And so it's important to keep those in line. It isn't necessarily influenced directly from your dietary cholesterol. So it is important to keep in mind that other factors can influence, since your body does have the ability to produce cholesterol. So staying active and healthy is more than just eating healthy when it comes to cholesterol, since your body does use cholesterol when creating things like hormones for your body. So do keep that in mind. But a total cholesterol that is high means that your body's not utilizing it and it's staying in your bloodstream, which does increase our concerns, as does a low HDL, which is be the better cholesterol. So it is important to keep those numbers in line when you get your blood work done. You don't necessarily need to be doing it as often as checking your blood pressure, but if you are getting a routine blood screening, those are two numbers to keep in mind. Your systolic blood pressure would actually be the next thing that could influence your blood pressure. So we're more concerned again with systolic blood pressure being high, since this does mean that the heart is working harder than it needs to. Since if it is in that high category, it does mean we're applying more pressure than we should need to in order for our body to get what it needs from the heart. So this constant overbeating of the heart with more contraction than it needs, which usually results in more beats. Because of that, we are more concerned with the systolic blood pressure when it comes to the heart. Next would be diastolic blood pressure, and this could just be because there isn't enough gap between your heartbeats, so your heart rate is too high, so your body doesn't have time to relax to actually get a true diastolic reading. Or it could also be because the passageways have narrowed, which is increasing the pressure, and they're not relaxing, which allows the flow to drop more as we are doing different activities. It's that ability to adjust is done by the diastolic in response to the systolic. So it is something for us to keep in mind, as it does have an impact since it shows how our body is adjusting. Are you being treated for high blood pressure? That is something to keep in mind, is if you are being treated for high blood pressure, keep in mind what impact that might have on your heart. And also, if you have a risk of high blood pressure, you are taking medication for high blood pressure and that's lowering your blood pressure, what impact has it had on your heart, and what can we do to help improve the health of your heart so that you can stay healthy and you don't need to necessarily depend on that medication as the only source to keep your blood pressure down. The next would be diabetes. Type 1 and type 2 does have an impact on the condition of your health. That high sugar level, especially if your blood sugar is uncontrolled as you're a diabetic, does have a major impact on the health of your entire body, and it does affect your muscles quite a bit. So it is important to keep in mind, especially type 2 diabetics, where it has been a change, where at one point it wasn't an issue, or we've had a build up and now there might be other risks, especially if your diabetes is uncontrolled. We do want to keep that in mind. So make sure to check your blood pressure regularly, along with your blood glucose levels, and check in with your doctor on a regular basis to make sure there's no changes in the body's ability to respond. The next would be smoking. So if you do smoke, and this does include all forms of tobacco and other inhalants or chewing products. So while I do say smoking, meaning with a cigarette, cigar, pipe, or whatever it may be, it does also include the chewing of tobacco or vapes or other forms of inhaling the materials. This does put more pressure on the lungs and affects the body's ability to exchange the oxygen and carbon dioxide, which can raise your blood pressure, and it also can have negative impact on your heart because your heart will have to work harder to get the carbon dioxide out and the oxygen in as it's moving the blood around. The bright side is even if you stop smoking for as little as 24 hours, you will see a decrease in your blood pressure in most cases just from that 24-hour period. Now going on to the stage 2 and the more increased level, it's important to keep in mind that if you do reach this level, this is when medication is immediately concerned. And this usually is caused from many lifestyle behaviors. And when we're looking at when we reach this stage 2, is doctors are likely to prescribe a combination of blood pressure medication and lifestyle changes at this point. They will not usually depend on just lifestyle changes at this point. And if you are ever prescribed a medication, they are encouraging, or hopefully they're encouraging you to also make changes to your lifestyle behavior so you don't become completely dependent on the medication, as otherwise we will see changes in the dosage necessary in order to keep the blood pressure even at the same level. Now, if you do reach the hypertensive crisis with a higher than 180 and higher diastolic of 120, wait 5 minutes and test again. If your readings are still high, you do want to contact your doctor immediately. It doesn't mean you need to rush to the emergency room and ask how they would like you to respond. If you do regularly check in with your doctor, then they'll be able to respond accordingly. But if you are experiencing chest pain, shortness of breath, back pain, numbness or weakness, either towards the center or peripherally, so it might just be like both your feet have fallen asleep, so keep that in mind, or maybe your eyesight is getting blurry or you're having difficulty speaking, is do not wait and see if your pressure comes down or wait to speak to your doctor. This would be the case where you would call 911 or have someone take you to the emergency room immediately. So can your blood pressure be too low? This is the other side of it. And according to the American Heart Association, most doctors will only consider chronically low blood pressure as dangerous if it's causing notable signs. So as your heart becomes healthier and you become more active and you're feeling better and you have energy, then we're not usually concerned with your blood pressure being too low. However, if you're experiencing dizziness, lightheadedness, or maybe you're having symptoms of fainting, whether that be a slight doze or a full-on faint, if your vision becomes blurry or you're feeling nausea or fatigue, you can get the cold sweats and begin shaking, or maybe you just have a lack of concentration. If any of these behaviors are noticed within yourself or in a loved one, this also could be a sign of low blood pressure, and this would be a blood pressure that is too low for the individual. Since as your heart gets stronger and healthier, it takes less blood pressure in order to control what your body needs, and it gets more efficient at it. So because of this, you could have a relatively low blood pressure and it wouldn't be an area for immediate concern if there are no negatives. We will notice this with some individuals later in age, is we might have a significant decrease in smaller individuals where their blood pressure could be quite significantly lower, like 120 over 50. And this isn't necessarily a sign of immediate concern, is if none of the other symptoms are there, that might just be how hard the pressure needs to be, because it's a sign of healthy arteries and veins, so the flow isn't interrupted and the body is able to respond very well to any changes. So what are some underlying causes of high blood pressure? So with this, we can have the low blood pressure can actually occur from prolonged bed rest. Oh, sorry, we're still on low blood pressure. So low pressure can become from prolonged bed rest. So if you staying in bed for an extended period of time, this can cause your blood pressure to get low. And you might notice that if you get up too fast or you feel lightheaded or dizzy, that is low blood pressure, but it's just your body adapting to the change in gravity. So if you recover rather rapidly, it isn't a sign of immediate concern with low blood pressure, but you do want to be safe and not overstress your body by changing too rapidly. So do keep that in mind. We don't want to have a risk of a fall or injury in that moment when your body is adjusting. So do control yourself as you get up. In addition, pregnancy can actually cause lower blood pressure in some individuals. And this can be changes to just the flow as organs are moved around, and other hormones being influenced can affect your blood pressure. The next is a decrease in blood volume. So this can be occurred in multiple ways. You may not be producing as much blood as you were before, just decreasing the overall volume. In addition, dehydration or lack of fluid in any form can cause, or high sodium, can cause the blood to become thicker and more viscous. So its overall volume is less because it's more concentrated, which is another sign that it's harder for the blood to be pushed through, which may result in a lower blood pressure. There are medications you can take that can cause low blood pressure, or if your dosage is too high for you of any blood pressure medication, any of these can cause a decrease in your blood pressure. So do keep that in mind. It is also one of the reasons they recommend not to drive while under the influence of certain medications, since it may cause a decrease in blood pressure, which can result in some of the symptoms and signs I mentioned earlier, which can be dangerous when operating a vehicle such as a car or other large object that could injure someone if you lost control. The next would be if you have heart problems, whether that be damage to a valve, just some kickback, is uneven murmur, irregular heartbeat. These different behaviors may influence resulting in a low blood pressure. So there are different things that can cause your low blood pressure, but changes in how the heart is functioning could be one of the signs. And also is what your doctor will look for when you first have low blood pressure, if you don't have a history of a consistently low blood pressure, to try and find maybe what the cause is of that change in your blood pressure to decrease. The next would be endocrine system. So our endocrine system does quite a lot for our body, especially from a hormone perspective. And because of the endocrine system changing and influencing different parts of our body, including the adrenaline system, this can influence our blood pressure as it relaxes or increases blood pressure, and how our body responds over time after being influenced by that. It's why we can see changes in our blood pressure after exercising. So we can have an increase in our endocrine system, and also the exercise improving our heart can cause our blood pressure to decrease temporarily after we exercise. If you do have a severe infection, such as septic shock, this does cause inflammation and can block pathways or cause other issues within the bloodstream, which could damage the body's ability to regulate the blood throughout our body, resulting in low blood pressure, especially in our peripherals, such as our legs and our arms. This is most commonly for severe infections for septic shock, seen in uncontrolled diabetics would be the most common case of it affecting our blood pressure, but it can be caused by other means as well. The next would be allergic reaction. So if you do have a reaction, maybe you're allergic to peanuts or something else is causing that anaphylactic shock, is because of that, we may see a lot of contraction. So there isn't really any room in the pipe for the fluid to go through. And this huge inflammation can cause a rapid decline in our blood pressure and restriction, which can be more immediate cause of it. If you're seeing wheezing or other responses, this is usually when you need to call 911, is if you see an immediate drop in blood pressure, since it's most likely anaphylactic or allergic reaction, or there could have been puncture causing bleeding. Those are the two rapid causes of a massive decrease in blood pressure in a more immediate moment. So a single lower than normal reading is not cause for alarm, and unless you're experiencing any symptoms or problems, there's no reason to change anything or immediately call your doctor. You can mention it to your doctor as you are speaking to them at your next checkup, but it isn't any cause for immediate concern. If you are, however, experiencing dizziness, lightheadedness, nausea, and any other symptoms I recommend or mentioned earlier, it is a good idea to consult with your healthcare provider, either by phone or set up an appointment to check with them. To help with your diagnosis, keep a record of your symptoms and activities at the times they occur. Sometimes these behaviors are influenced by changes in your activity. So if you do, let's say, get out of bed and you check your blood pressure and your body didn't recover before you sat down, this could cause a low blood pressure reading. Or maybe there's a certain activity that is causing your blood pressure to drop. And if that activity is causing it regularly, we might be able to better identify what overall is causing that low blood pressure during that activity. So keep a record of when these are occurring. So the question that you were probably asking is, are you at risk for high blood pressure? Am I at high risk for blood pressure? And so there are a few risk factors we cannot control for high blood pressure. The first is our family history. So if you do have a history of high blood pressure in your family, if that be high blood pressure in a male under 55 and under, or a female or in 65 and under, if either of those occurring, those are a family risk of high blood pressure. Or if anyone in your family needs to take high blood pressure medication, you will want to let your healthcare provider know. The next is age. We do see changes and slight increases on average in high blood pressure as we age. It isn't cause for immediate concern, but it is something to keep in mind. It's also why you'll sometimes see more lax opinions of using medication or other influential factors as someone age on their high blood pressure, since it may not be of immediate concern, especially if it's later in life that they've developed high blood pressure, as it does take time for the high blood pressure to cause damage. So slightly higher readings in your 60s and 70s, if you lived a relatively healthy life up to that point, is not as much of an immediate concern as a slightly lower high blood pressure at a younger age. The next is gender. Again, this is associated, so they will look at more concern if you're younger, usually 55 and under in males, and 65 and under in females is where they'll be more concerned if they see that high blood pressure. So men are at a higher risk of getting high blood pressure and other heart-related diseases. As a result, some of the other risk factors, but there are races including Asian populations, the Filipino, other Latin and Hispanic Southern populations, along with African American and Native American populations, do have a higher risk of high blood pressure than some other European and Caucasian descents. If you have one or more of the above, it is something to keep in mind that it does increase your risk, since we don't have the ability to control any of these. They are risk factors, and you can change things. Sorry, okay. If you have one or more of these risk factors, you can still decrease your risk, since a lot of the factors I'm about to go over will be the ones you have the ability to control. So risk factors that can be controlled are smoking and exposure to secondhand smoke. So if you or a loved one do smoke, like I was saying, you can see changes in 24 hours or less if someone were to give up smoking. So you can see great changes in blood pressure, whether that be your exposure from someone else or you directly are smoking. So it is a good area to make changes when you can, even if that's a decrease in the initial stages and then leads to you quitting over time, is it does help, since you will see over 60% of your body recover in less than a year if you are able to give up smoking, or you can eliminate your secondhand exposure. Now, if you are in a household with an individual that does smoke, the best way is to encourage them to do behaviors that would remove you from that smoking environment, such as requiring them to smoke in a certain area. Maybe that's on the back porch, or smoking away from the home so they're not doing it in the home. This is one way to reduce it. You also could offer other alternatives to help decrease the bringing of it back into your home, such as I know my grandmother would have my grandfather wear a jacket, and he would wear the jacket while he smoked, and then he would take it off and he would leave that outside when he smoked, which brings less of it back into the home when they return, and to leave a pause in between when they cease and they come back into the home, not immediately stopping, putting out their cigarette and returning to the home, letting the air kind of flow for a little bit before returning to the home. These factors can help reduce your the impact of the smoking on secondhand, especially in your household. So diabetes. So if you are diabetic or if you're pre-diabetic, is there are actions you can take to help reduce your chances. If you are pre-diabetic, this is the best time to take action. So if you are experiencing the signs or you are getting readings of higher than normal blood sugar, this is when you can take lifestyle behavior changes such as physical activity and eating healthier. You may qualify for programs such as a diabetes prevention program that could help you learn about different lifestyle changes you could make to help improve your chances of decreasing your risk of blood pressure, of diabetes, which in turn would decrease your risk of high blood pressure. If you do already have a diagnosis of diabetes, there are programs such as a diabetes self-management education program, which is another program we offer at Sun Health, but you may find it other places if you're not located in Arizona, where you can work with registered diabetes educators to learn different lifestyle behavior changes that can help regulate your blood sugar and help your body have less stress, even if your pancreas is not functioning as ideally as you would like. Next, if you are overweight or obese, these are they are impactors and influence your risk of high blood pressure. So changes in as little as 5 to 10 pounds, a change in just a couple percent of your overall body weight can impact your overall high blood pressure. So making changes to your overall weight through lifestyle or through nutrition changes, so just lifestyle, exercise, all these influences to decrease your overall weight can see a change in blood pressure, which results in improvement overall. Even if you don't have a high blood pressure diagnosis, this can help prevent you from getting a diagnosis later in life. The next is high cholesterol. Again, this isn't necessarily your dietary cholesterol, so it's being physically active and living a healthy life and making proper health choices does improve your chances of decreasing your high cholesterol. Sometimes medication is necessary to change your blood pressure or your high cholesterol and influence the change in the blood. So it is something to monitor with your physician if you're not seeing changes in your lifestyle. Specific diets such as the Mediterranean diet and other diets that are more plant-based can help you decrease your overall high cholesterol, as that improves your overall health in other ways as well. It isn't necessarily just the cholesterol in the food, but decreasing red meat consumption and sticking to leaner proteins can help, especially in higher cholesterol environments. So an unhealthy diet high in sodium, low in potassium, or drinking too much alcohol does have a negative impact on your blood pressure. So if you do have high sodium in your diet, it's important to look at ways to decrease that sodium. You do want to keep it under 2,300 milligrams, which is just a couple of tablespoons. But is most of the time the high sodium content isn't coming from meals we prepare at home. It comes from meals that we get outside our home, especially if it comes from a standard drive-through. I know a lot of places have made mock drive-throughs in our current situation, but if the place that prepares your meal has a regular drive-through, many cases that have those prepared meals, those fast food meals, those are the ones with the highest level of sodium. So you do want to keep those numbers reduced and under control. The next is a low potassium. So there are plenty of foods high in potassium, such as potatoes, leafy greens, coconut water, and coconuts are high in potassium. These foods help to regulate our blood pressure and keep our heart healthy. So keeping our potassium high can help influence our blood pressure as well. The next is drinking too much alcohol. So the recommendation is to keep the alcoholic beverages to no more than 5 days per week, with it only being the 2 beverages per male and 1 beverage per female in that day. The amount is influenced by the percentage or the proof of the alcohol. So 1 shot is equivalent to the 4 to 5 ounces of wine. So it does keep in mind that a drink isn't just how much you fit in your cup. And then physical inactivity. So in addition to being physically active, being beneficial for your health, is being physically inactive has negative side effects as well. It isn't just if you're physically inactive, you don't get any better, is it actually can cause your body to get worse. So that's important to keep in mind. Isn't just a flat plane, it is a slant all the way through. So if you're right here, working on physical activity can improve. If you don't work on physical activity, you can roll down the hill. So let's talk about stress and blood pressure, especially in times like this where there might be some uncertainty or concerns that might be raising our blood pressure higher than normal. Stress is considered a potential contributor to a risk factor for high blood pressure. So it's important to keep that in mind as you're doing your daily life. Is I mentioned a acute opportunity of like white coat where you have stress from entering a doctor's office, but any changes in blood pressure are influenced by this. So your body responds by constriction of the blood vessels, and this does raise your blood pressure, but it's but only temporarily. So if your body responds to stress and it tightens up, that increases your blood pressure for a moment, but as long as you relax and let that stressor go away, then it will relax and return to normal. So when the stressor goes away, blood pressure usually returns to its pre-stress levels. And so that's a good thing to know. Now, if you are identifying the stressor, something that might not go away as immediate. So the reason we have this response would be, let's say we were a gazelle or an antelope and we were being chased by a tiger, a lion, or something else, is your blood pressure raises from the stress, it contracts, and certain functions, your metabolism decreases, your higher thinking functions decrease, and your body's responding to that reaction, and it's a running away from that tiger, bear, whatever it may be, and that's the restriction. But then once you either get away and it will return to normal, or you don't get away and it's not really a problem anymore. But because of that, is if you are identifying something that isn't chasing you per se as one of these threatening stressors, that's where it's a bigger risk. So we don't get chased by tigers, lions, and bears as much as we used to, and we're not a gazelle or an antelope or another animal. And so because of that, is what we usually identify as some of these higher stressors will linger for much longer. So some people cope with stress in different ways, but even the stress itself. So let's say you say your mortgage, your student loans, or maybe a change in the stock market or something of that course, and you see that as that overlying threat and it's raising your stress, that doesn't go away as quickly as you're only running for a couple minutes. That stressor can last longer. And if your body is responding in the same way, it's that constant stress of that higher blood pressure that increases your risk. Now, into the addition to this, some people cope with stress by eating poor diets or maybe eating more food than they were regularly. Maybe they start smoking or smoking more than they used to, or they start drinking alcohol or large consumptions of alcohol. And these also raise our risk for a heart attack, stroke, and high blood pressure more than the stress did by itself. So there are medications and substances that might increase your blood pressure. So if you do take caffeine, so if you know you're going to check your blood pressure, or if you're going into the doctor's office to check your blood pressure, drinking your cup of coffee, tea, whatever it may be in the morning before does increase your blood pressure and makes it more difficult to lower your blood pressure as well. So if you are going to go exercise or do physical activity to help improve your overall blood pressure and your heart rate, things such as caffeine can affect that. So many people will take like a pre-workout to raise their heart rate to give them more energy. It does make it harder to influence the body's ability to respond and improve your heart rate after, if you're taking something like caffeine, maybe a decongestant, or even herbal supplements or recreational drugs. All of these can cause an increase in the heart rate or the blood pressure temporarily, which also can make it more difficult, since you have that stimulus, to work on lowering it while it is still in your system. So what are the consequences of uncontrolled or undetected high blood pressure? So it is over time, it increases your risk of heart attack, stroke, heart failure, vision loss. You can have sexual dysfunction. You can have kidney disease or even kidney failure from high blood pressure. Our kidneys in particular are very sensitive to changes in our blood pressure. So it is something to keep in mind. So if you do have a high risk of blood pressure, you are noticing you're having kidney changes, is the underlying cause might be your high blood pressure. So if you're able to get your high blood pressure under control, you may see improvement or at least less loss of function in your kidneys. You also can develop peripheral artery disease if you have uncontrolled blood pressure for an extended period of time. So high blood pressure complications. So damage from high blood pressure can cause the blindness, the strokes. It affects every part of your body, as you can see, is whether that be up in our brain with a stroke or all the way down to maybe peripheral damage in our toes or neuropathy. But the areas more towards the center, such as our heart, our kidneys, and other organs in the center of our body, are at the highest risk for developing damage as they're closer to the heart where the pressure is the highest. So from a prevention treatment, the best way to approach this is to start with quitting smoking, weight reduction, and decreasing your sodium in diet and limiting your alcohol. These are the 4 things that I would approach first if you're working on lowering your blood pressure. Quitting smoking is the number 1 thing you can usually do to reduce your blood pressure, since it has the most immediate response. Not necessarily it's the biggest influencer, but since your body will respond to quitting smoking rather rapidly, it helps improve your chances overall more quickly than you would be able to healthily lose weight or decrease the sodium in your diet. After you've done this, focusing on weight reduction and decreasing your sodium and limiting your alcohol intake can all be done simultaneously. You don't need to cut sodium completely out of your diet. Just be more conscious of what is in your diet. And then working on weight reduction will take time, but controlling the amount of calories coming in and focusing that your energy expenditure is similar to the amount of food you're taking in so that there isn't an imbalance resulting in an increase in weight. If you're spending more energy than the food you are consuming, that's what causes us to see a decrease in our body weight. And then limiting our alcohol. It doesn't mean you have to abstain from alcohol. It's just maybe having a drink every once in a while instead of using it as a stress reliever or over drinking because it is readily available. The next is ways you can work on this is following the DASH eating diet for dietaries against sodium hypertension. Is if you follow the DASH diet, and we have done this talk before, and I'm working to schedule it again for while we're online doing classes on how you can follow the DASH diet. But you can also easily search it, but it's very similar to the Mediterranean diet, but it focuses a lot more on your overall sodium. The next is taking your medication as prescribed. So if you have been prescribed a medication, whether that be for high blood pressure or something else, taking it consistently and as it was prescribed is very important for maintaining your health so that you don't see negative impacts from irregularities from your body not being able to adapt. And then participating in regular physical activity. We are posting some of our exercise classes online to help you stay active in your home. So keep an eye out for those. We'll be doing them live, and we're working to record some as well so they can be readily available to you whenever you're available. And we're focusing on activities currently that can be done from your home. I know many gyms and rec centers are currently closed. So a lot of the exercises and activities we'll be recommending over the next few weeks will focus primarily on activities you can do in a less optimal environment, but allows you to stay healthy and well. So as we're quitting smoking, every time you smoke, it also causes a temporary increase in blood pressure. And smoking is most important preventable cause of premature death in the United States. So as we work on decreasing smoking, this improves our overall health and helps reduce your risk of high blood pressure at the same time. For your overall health, to reduce your risk for a heart attack and stroke, avoid all forms of tobacco as well as secondhand smoke. So for weight reduction, maintaining a healthy weight provides many health benefits. Even a small weight loss as little as 5 to 10 pounds can help you manage or prevent high blood pressure. And many overweight people, those with a body mass index above 25 or at 25, are at the highest risk and will benefit the most from decreases in their overall body weight. So decreasing your sodium. What should daily sodium intake be? Like I was mentioning earlier, the American Heart Association recommends no more than 2,300 milligrams a day. An ideal limit would be no more than 1,500 milligrams a day for most adults. So do keep that in mind, especially if you are more sensitive to sodium. Maybe you bloat, or you'll see your hands get puffy after high sodium content. Dropping to 1,500 milligrams a day can help with some of those side effects as well. So more than 75% of the sodium Americans eat come from processed foods, whether that be prepackaged restaurant foods, and are not from our salt shaker. I know food options can be more limited at a time like this, but please keep in mind as much as you can how much sodium you're consuming. And if you do happen to be consuming more sodium and it's not completely in your control, please make sure that you are consuming more water to balance out with the amount of sodium you're intaking. So hopefully you can flush it out. So limiting the alcohol intake. So drinking too much alcohol can raise your blood pressure, and limiting alcohol consumption can help prevent high blood pressure. If you drink, limit your alcohol consumption to no more than 2 drinks per day for men and 1 drink per day for women. And then following the DASH diet. So dietary approaches to stop hypertension, and it's high in fruits, vegetables, and low in dietary foods, low fat dairy foods. The DASH eating plan also includes whole grains, poultry, fish, nuts, and has low amounts of fats, red meats, sweets, and sugary beverages. Taking your medication as prescribed. When blood pressure is high, medication may be an important part of your treatment. Your healthcare provider will also likely recommend lifestyle changes along with your medication, and you may even need more than one type of prescription in the beginning as you work to help improve your health levels. Regular physical activity is not only helps control high blood pressure, but it also helps you manage your weight, strengthen your heart, and lower your stress levels. So for most healthy people, build up to at least 150 minutes per week of moderate physical activity. Is about 30 minutes, 5 days a week. And moderate physical activity such as brisk walking. Include flexibility and strength exercises, and include muscle strengthening activities at least 2 days each week. So how does exercise affect your blood pressure? It comes down to changing the blood vessel diameter, and high blood pressure affects the endothelial function and lessens the ability of the vessel to widen. So as you exercise, your arteries and the endothelial tissue can respond better, which allows it to adapt your blood pressure more overall, which can help improve your health. Norepinephrine, which is a vasoconstrictor levels, are decreased after exercise. So you produce less hormone that would cause your arteries and veins to constrict after you exercise. And training also lowers your endothelin 1, which is a potent vasoconstrictor, just like norepinephrine. And an increase in nitric oxide has been shown after exercise, which improves vasodilation. So most of the air we consume is full of nitrogen. It's the number one molecule in our air, and we'll see changes in the nitric oxide as we exercise, and because of that, those actually cause the blood vessels to dilate more, which allows for better flow. So for a healthy heart, you can work on improving your health by making your beats stronger. You can have more beats to make it stronger, or if you have fewer beats, that can result in a healthier heart, and a larger heart can also influence that as well. Your body muscles do help affect your blood pressure. So as you walk around, you're helping your body to pump the blood back up from your legs. So as you actively move around, you can take stress off your heart, which also can improve your body's ability to improve its blood pressure overall. So the angle of your body does matter. If you are sitting more than you regularly would right now, or you're laying down more than usual, it's important to get up and move around so that your regulation can be controlled. So with that blood vessel dilation, you can see that tissue on the inside does have the ability to move around. And as it narrows and can't dilate as much, it makes it harder for it to open up, which causes even a small amount of buildup of plaque to be more detrimental to your overall health. So for exercise precautions, check with your doctor before beginning vigorous activity. I know while we're in our home, this might be a little more difficult anyway, But if your blood pressure is 180 over 110 or greater, avoid exercise until you can see a physician and they can prescribe you a medication to take as you exercise. And warm up slowly and cool down gradually to not shock your system. Dress comfortably and drink water before, during, and after exercise. It's important to drink plenty of water throughout the day. The usual recommendation is to drink half your body weight in ounces, and that would be the amount of water you roughly want to drink. So if you weighed 100 pounds, you'd roughly want to drink about 50 ounces of water per day. So never hold your breath. Exhale while you exert. You don't want to be holding your breath while you're being physically active, as this will cause your blood pressure to rise in the moment and can also lead to lightheadedness, dizziness, pain in the chest, and discomfort, or you might have difficulty breathing afterwards. So if you do start feeling any of these symptoms, stop exercising immediately. And if the symptoms don't go away after stopping, you will want to call a doctor or 911 if the symptoms are still there. If you do have a home blood pressure monitor, people with high blood pressure, it does help them keep their blood pressure under control, especially times like now, so you don't need to take unnecessary trips to have your blood pressure monitored at a hospital. Getting active to a device, just making sure to not move around and stay silent as it measures your blood will help. And even if it's slightly off in measurement, if it's consistently the same with itself, you will be able to compare it to a later date to maybe your physician and know roughly how much off it might be. But if your blood pressure goes up on the machine, it probably is higher than it was from the last time you measured. The American Heart Association does recommend automatic cuffs, especially at home, the ones that go on your upper arm. And for blood pressure monitoring, it may be especially useful to evaluate potential false readings. So if you only have high readings at the doctor's office, that's another reason to have one at home. And then people who only have high readings at home, it might be better to get the checked at the doctor's office. And this is called masked hypertension, where you have high blood pressure at home because it stresses you out, but you actively reduce it or calm yourself down when you're in the doctor's office. So if you are monitoring at home, make sure the cuff fits and use the correct size. If the cuff is too big, it will give you a falsely low reading. If the cuff is too small, it will give you a false high reading. Most people will fall into the regular range in the middle, but there is a little line on the cuff. So make sure that you're falling into that range and you don't need a different size cuff for your device. This is especially important with children or individuals with smaller arms. And take the readings at the same time each day, in the morning before medication and in the evening before supper. These are usually the best times to measure it. And if you consistently take it the same time each day, it helps compare to how your body is responding at the similar time period and scenario. And don't smoke, drink caffeine beverages, or exercise within 30 minutes before measuring your blood pressure, as this can cause a false high or a false low in the case of exercise. Sit in a supportive chair with your back straight and feet flat on the floor, and don't cross your legs. Try and prevent talking and moving of any kind, especially when using the automated cuff. Your arm should be supported on that flat surface of the table or arm of the chair. Try to make the cuff on bare skin, so don't do it over a sleeve. So roll up your sleeve if you can, or even better, have a shirt that the sleeve doesn't need to be rolled up, because as the sleeve gets too tight, that can also influence your blood pressure. And make sure the middle of the cuff is placed directly over your brachial artery, which is slightly inside, right above the elbow. For some individuals, it is visible, and for others, it might not be. You can apply pressure there and usually feel a slight beat, but generally it's the inner side right above the inside of your elbow. And then remain quiet, relaxed during the measurement, not talking to anyone, even to yourself. And take at least 2 readings, 1 minute apart if there was no issues. If it was a high reading, I do recommend waiting the full 5 minutes, but leave the cuff in place and do not move it while measuring. And then bring the blood pressure log with you when you go to the doctor's office. Okay, just a couple true or false, and you're welcome to respond in the chat box if you'd like to. So, high blood pressure runs in my family. There's nothing I can do to prevent it. Is this true or false? So the answer would be false. So high blood pressure may run your family, but there absolutely are different activities and lifestyle factors that you can influence to decrease your risk. If you feel fine, I don't have to worry about high blood pressure. Is this true or false? This is also false. It's because it is oftenly called the silent killer. You may not notice any changes externally with high blood pressure until it's already time to report to a physician. If you're in a crisis state, you may then notice your high blood pressure. But in most cases, it goes undetected, which is why it's important to check it regularly and make sure to check in with your physician if there's any cause for concern. I don't use a salt shaker, so I'm controlling my sodium intake. This is also false. Good job, everybody. So as a reminder, most of the salt will come from prepackaged or restaurant foods. So it's important to keep in mind that most of the salt is going to come from an external factor. So ask for low sodium or try and prepare more of your meals. And then I read that wine is good for my heart, which means I can drink as much as I want. Unfortunately, this one is also false. You guys got that right. Is that study was actually done by a alcohol distributor. So while wine is better for your health than many other forms of harder liquors, it is still something you want to keep to 2 beverages per day for males, which is roughly a beverage for wine, beer is in that 4 to 8 ounce range. You have to check by the proof, which influences that, or like a single 1 ounce shot of a harder liquor, and 1 drink per day for women. And then I was diagnosed with high blood pressure, but I've been maintaining lower readings so I can stop taking my medications. And this one is also false. You do not want to stop taking your medications until advised by your physician. If you do work hard and exercise regularly, there are chances of you getting off your medication. Usually they'll reduce the dosage before taking you completely off it to make sure that you're continuing the lifestyle behaviors. Because if you get off the blood pressure medications and stop the lifestyle factor changes you've made, it's likely that your high blood pressure could return. So thank you all so much for joining me today. Do we have any questions or comments? I'd be happy to address them now. I've got a few minutes over, so it's okay if some of you need to leave. Well, thank you all so much for joining me, and I hope you're all staying happy, safe, and healthy, and I hope to see you at another talk soon.